Medical surgical nursing will test you on the following areas. And yep, it is actually an integration of your previous nursing subjects. So if you've had a very good foundation with these subjects, then Med-Surg will be a lot easier for you. But if you're like me who had a relatively poor foundation, then Med-Surg will be extremely overwhelming and time-consuming, especially if you don't have the right system. So, here's a foolproof system that you can use to help you become consistent with your exam scores and never fail a term exam. The first thing I suggest you to do is to take your time reading the table of contents first. Because the thing is, it is very easy to get lost if you look at the sheer amount of material that you need to consume. If you study disorders one by one, you won't have enough time to cover all the materials that you need to cover. Here's an example. In hematology, there are roughly 40 blood disorders discussed in this book. Instead of studying them one by one, it will make more sense to study them as a group first, because 2 or more disorders will have similar signs and symptoms, similar management, and similar diagnostic test. By classifying disorders first, you will save more than half of the time you will spend in studying. Before reading an actual material, doing a pretest will give you an idea of what topics often appear on the exams. You probably heard about Pareto principle or the 80-20 principle. If you apply this principle in the exams, it simply means that 80% of the questions are lifted roughly from only 20% of the given material. And so, by doing a pretest, you are priming your brain of the things that you need to study first instead of wasting your time on the topics that doesn't come out as often. Med-Surg rely heavily on texts, and it's so easy to read passively. So when taking notes, make a template that will force your brain to actually remember and understand what you are reading. Here's an example. After doing your pretest in your logic system, you would know that strokes or cerebrovascular accident is often asked. So I go on and study the material with these questions in mind. First, I would ask, what is the problem and why does it happen? How do I know that the patient is having stroke? And lastly, what are the areas of concern and what should I do if I'm caring for this patient? During this time, I am not worried about remembering all the details because you want to go broad before you go deep. And instead of studying like a test taker, try and consume the material like a test maker and constantly ask what parts of the material are actually testable. Before your actual exam, I would encourage you to answer at least 100 questions for the topic given. And honestly, if I only have an overnight to study, I wouldn't even read my notes or my books. I would simply spend the rest of the night doing practice questions as much as I can. 1. Some of the questions you could answer may appear on the actual exams, which happens quite a lot on nursing exams. And 2. Reading the rationale of each question is actually the most effective way to train your brain to reason out your answers. The rule of thumb I use to force myself to study test questions: if I can't rationalize my answer, I can't consider my answer right. Because your confidence in answering questions is mainly attributed to your ability to rationalize your answers.